Hi, I'm Dr. Aviva Pinto Rodriguez, Senior Consultant and Clinical Director at Nova IVF Basaveshwara Nagar, Bengaluru. I'm going to talk to you today about ovarian reserve, a little bit about AMH, and discuss with you a patient who came to us with the desire to have a baby of her own, although she was close to 40 with a very, very low ovarian reserve, but was very determined that she would have a baby with her own gametes and not anybody else's. Before I go any further, I would like to explain to you all what ovarian reserve means. Unfortunately, women do not have an unlimited supply of eggs in their lifetime. They are born with a fixed number of eggs that they start releasing from the time they attain menarche, which is when they are about 10 or 11, and they continue releasing these eggs till they are about 40 or 45, by which time the entire reserve is over, and then they attain menopause. The average age of menopause for an Indian woman is about 46 to 47 years. And that is why it's very important when a patient comes to us that we need to know what her ovarian reserve or how many eggs she really has left, because that would help us decide what treatment we can offer her and how fast we need to offer that treatment to her. So we had this patient who came in with an ovarian reserve of 0.3, which is way below what the normal is. A normal ovarian reserve is about 2 to 4, and this patient had been told everywhere that she could never have a baby with her own eggs and that she shouldn't waste her time and her money and she should just go with a donor cycle. She was very clear that she was willing to do anything to try and have a baby with her own gametes. So we did counsel her, we did not paint a glorious picture, we gave her the prognosis as it was, guarded, and told her that we were willing to go that route with her as long as she was willing to go through maybe 1 or 2 cycles, because with a low reserve sometimes that is needed. So we stimulated her after we got all the tests and everything done. In the first cycle we got 3 oocytes, which went on to be fertilized with her husband's sperm, but unfortunately ended up with no viable embryo at the end of the cycle. Now this could also be because not only did she have a low egg reserve, she was also hit almost 40 years old, so the quality of the eggs also would have been compromised. So we did a second cycle about 2 months later, and this time we managed to get 4 eggs, 3 of which were good, again injected with her husband's sperm. Ultimately, with 1 good egg, 1 good sperm, God above, and a lot of science, we managed to get that 1 good embryo. We did a genetic testing on it, which is extremely important when the patient is of advanced maternal age, that is above 38 or 39, because at this age they tend to have more embryos that are abnormal. This embryo came back euploid or normal, and then we transferred this embryo into her uterus, and by God's grace she was pregnant, and 9 months later she had this lovely bonny baby boy. We are happy that when she came to us with a desire, with science and all the technology that we have here, we managed to get her an embryo of her own and fulfill that desire. Watching her go home with her baby boy was probably the happiest moment in her life and one of the happier moments for us here at Nova IVF. Thank you.